To ABC News, we're taking you live to Sydney where New South Wales Premier Gladys Berejiklian is speaking.
Result on a weekend, and we need to keep those testing rates as high as possible. We had 239 cases of community transmission, 35 at least of which were infectious in the community. Now, we are again seeing the virus circulate in workplaces and households, and that's been a consistent trend. The one positive takeout is that the virus has not in the main gone outside those 8 local government areas of concern. Having said that, we don't want to see the virus spread further, and we certainly don't want to see households, whole households, become infected because one person has brought the virus into the home. Today is the 1st of August, and I'm calling upon the people of Greater Sydney, of Greater New South Wales, to come forward and get vaccinated. To get to the 70% target, we need 9.2 million jabs. To get to the 80% target, we need 10 million jabs. And we've been talking about this in New South Wales for some time. Pleasingly, in the last 24 hours, we had over 82,000 people get vaccinated in one day alone in New South Wales. Now, at that rate, we're vaccinating about 500,000 people per week, but we want to do more. We want to go faster. So please come forward and get the vaccination. The AstraZeneca is safe. The health authorities have said that under the current circumstances, any adult, anyone over 18 should come forward and get the vaccine. And it doesn't matter which one you're offered, just come forward and get vaccinated. The one dose itself reduces your chance of spreading the virus, but it also keeps you out of hospital. And we know the vaccination is working against this terrible Delta strain. We know it's effective. We know it's keeping people out of hospital, but it's also reducing the chance of people spreading it to every member of their household. So can I please urge everybody to come forward and get vaccinated? The consistent message from New South Wales is proving to be the right way forward. Come forward and get vaccinated. Whether it's the target of 70% or 80%, we know once we hit those targets, life will be very different for us. We don't want to be in a situation where we're going in and out of lockdowns, and certainly in New South Wales our aim is to get out of this one as quickly as we can. We have a month of August to get our vaccination rates as high as possible. The New South Wales Government is continuing to increase our hubs, working with the GPs, getting more pharmacists on board and making sure we get as many jabs in arms as possible. Let August be the month where we break records in the vaccination. And again, I was so pleased to hear that in the last 24 hours, 82,000 people in New South Wales got vaccinated. Again, that is a good number. We can do better. So please come forward. It's safe. If anybody has any concerns, go to your GP and ask the questions. But please know that it's only through higher rates of vaccination that we can continue to protect our community, that we'll be able to contain the spread of the virus by making sure less people are contagious, but also by following the restrictions. It's a combination. We need to make sure people follow the health advice, follow the rules that are in place, and that is so critical. Please know, if you live in those 8 local government areas of concern or any suburbs in that area, don't go outside the house unless you have to. Even a close relative, like a parent or a sister who lives in a different household, is at risk of getting the virus or giving you the virus. Please be aware of all those risks. And as Dr. McAnulty will report, workplaces are a constant place where adults are taking the disease, passing it on to other workers and having it spread to other suburbs, and we need to stop that. So I thank everybody for their work to date, and let's make August the month where all of us who haven't had the vaccine come forward and get vaccinated. As I've said, I've had the AstraZeneca, Dr. Chand has, Minister Hazzard has, many people of my family have had the AstraZeneca vaccine. It's a safe vaccine, it works, and we know that the more people that get vaccinated, the closer we have to living life as normally as we can with the Delta strain. And we know that all Australians will be facing this challenge. All Australians will need to get their vaccination rates up. But in New South Wales in particular, we have a sense of urgency. We can't wait, and we want people in August to really come forward and get vaccinated as soon as possible. Dr. McAnulty.
Thanks very much, Premier, and good morning. I'll go through the numbers with you. There were 241 cases of COVID reported in New South Wales at the 24 hours to 8 o'clock last night. Of these, 239 were locally acquired and 2 were overseas acquired. 115 of the locally acquired cases are linked to known cases or clusters, and the source of 124 is still under investigation. There have been a total of 3,427 locally acquired cases reported since the beginning of this epidemic on the 16th of June. 87,712 tests were reported to 8 o'clock last night, compared to 105,963 the day before. By isolation status, of the 239 locally acquired cases, 80 were in isolation throughout their infectious period and 35 were in isolation for part of their infectious period, and 26 were infectious in the community, and we're still following up the other 98. By hospitalisation status, we've got currently 222 people with COVID in hospital, 54 in intensive care, 25 of whom require ventilation. Of the 54 in ICU, 7 are in their 20s, 5 are in their 30s, 2 in their 40s, 16 in their 50s, 14 in their 60s and 10 in their 70s. Just shows that this disease can be very serious in younger people as well as older people. Of those 54 in ICU, 49 were not vaccinated. 1 person had the first dose of Pfizer and 4 people had their first dose of COVID-19 AstraZeneca vaccine. By breakdown by local health district of the 239 cases, 110 were in southwest Sydney, 51 in Western Sydney, 69 in Sydney LHD, 3 in southeast Sydney, 4 in northern Sydney and 2 in the Nepean Blue Mountains. We're concerned that people everywhere should come forward for testing, but particularly in the suburbs where we've seen cases and transmission. So I'll just read out what those suburbs are. In Western Sydney, Cumberland LGA, Parramatta LGA, all of Blacktown LGA, and Western Sydney in general. In southwest Sydney, of course, Fairfield, Canterbury, Bankstown, Liverpool and Campbelltown. In the inner west, Rhodes, Balmain, Annandale, Campsie, Lakemba, Roselands, Punchbowl, Belfield, Hurstville Park, Homebush West, Belmore, Earlwood, Wiley Park, Strathfield. In northern Sydney, Ryde, Belrose and Morriewood. In southeast Sydney, Bayside, Georges River, Sutherland, Bondi Junction and Haymarket. In Western Sydney, Western New South Wales, Molong, where we've had positive sewage detection. In Hunter, New England, Armidale, where we've also had a positive sewage detection in recent days. And also in the northern Central Coast and Wollongong. People in those areas, please come forward for testing with the mildest of symptoms. We're concerned about that young people, particularly in the 18 to 39-year-old, are driving a lot of this epidemic. We're seeing cases at high rates in that age group. And this is the age group that tends to be a link between kids, younger people, and older elderly relatives. They're working, they have big social networks. And so if you're in that age group, it's important that you be aware that you're very vulnerable to the infection. As we've seen in ICU numbers, you can get very serious disease. So it's really important you come forward for vaccination. We're also seeing stories of people where their neighbours are doing the babysitting, or grandma is looking after the kids in a different household. So we're really concerned that you must stay within your household. You must not have visitors outside your hospital. You must not have visitors outside your household, even to babysit your children, for example. We've also seen a number of outbreaks and cases, particularly among adults in childcare centres. So it's just a reminder that please just reserve childcare centres if you really need to have your child in childcare. Otherwise, keep them at home to minimise the spread in childcare. Thank you very much.
Good morning, Premier. Good morning, ladies and gentlemen. Can I begin by thanking the vast majority of the community who worked with police yesterday during our large-scale operation in and around the city. Police deployed over 1,300 officers to the city and surrounds. Traffic and Highway Patrol alone checked over 70,000 vehicles. Yesterday's operation was successful in stopping a repeat of the events that we saw last week and a potential mass seating incident. Unfortunately, 8 people were arrested and over 250 infringement notices were issued in relation to offences mainly for people who were outside of their local government areas without a reasonable excuse. I can indicate that operation is ongoing across Greater Sydney today, so anyone who is thinking of participating in a protest-type activity will be dealt with. In coming days, it's important to note that police will be enforcing compliance around QR codes, and the wearing of face masks in and around shopping centres and large retail stores. Health advice indicates that they are areas of concern, and police will be clamping down on the use of face masks and QR codes. There is simply no excuse for not using those QR codes or wearing a face mask in those situations. In terms of the wider compliance operation, I can indicate that overnight, in the last 24 hours, 516 infringement notices were issued. 38 persons were arrested for offences relating to breaches of the public health orders. Police responded to almost 1,800 COVID-related jobs. Almost 1,100 of those were reports from Crime Stoppers. Disappointingly, what we saw overnight is a number of people involved in gatherings in breach of the public health orders. 12 infringement notices were issued to people who gathered in a hotel in the city. 14 infringement notices were issued to people who gathered together at a location at Walleye Creek, and a further 8 infringement notices were issued to people who gathered at a private residence in the Chipping Norton area. That is simply not on. I cannot stress enough that those breaches are, we won't tolerate them. I cannot stress enough how important it is for you to remain within your local government areas. What you need to know is that if you are intending to attend a gathering like that, your neighbours are picking up the phone and they are telling police, and we are taking action. So again, I remind you, do not breach the public health orders. It's vitally important that you abide by them. Thank you.
Deputy Commissioner, given that we didn't really see those protests eventuate yesterday, do you stand by the amount of resources that were thrown at the operation?
Absolutely we do. As I indicated, yesterday's operation was a success in ensuring that we didn't see a repeat of the events that we saw last week, the disgraceful events that we saw last week, and ensuring that there wasn't a mass seating event. So absolutely we stand by the use of those resources. And again, as I said, the operation's ongoing. So if you are thinking of participating in a protest type action, we'll be there and we'll be dealing with you.
Deputy Commissioner, do you kind of prevented Oakhurst too in the last 24 hours when police attended and there was an altercation?
Yes, that's right. Again, criminal behaviour where police officers were assaulted and in trying to enforce the public health orders, and that's simply not on. But again, as I said, police will be out and about. 516 infringement notices issued in the last 24 hours and 38 people charged. It certainly demonstrates that we will be out and about and will take action. As the Commissioner has said this week, our compliance operation will be ramping up, and it has ramped up and will continue to do that.
Dr. McAnulty, yesterday there was 120 cases where the isolation status was still under investigation. So these are the numbers reported from yesterday. Have you worked out whether those 120 cases reported yesterday were isolating or were not isolating?
You must.
Oh, sorry. Thank you. Yes, we gather information as the days progress on their exact nature. So we update that information each day. So we do have this morning for yesterday's numbers, we have a relatively large number of unknowns, but they get identified as we go through. And the trend over time has been pretty steady in terms of the number of people who have been isolating in the community.
How many of those 120 were isolating?
I can't tell you exactly that now. We can get back to you about the details.
Dr. McAnulty, can you please confirm for us reports that I've received that there are 9 cases of COVID inside a nursing home at Summer Hill? And if that is the case, why we haven't led with that information today?
So there are a number of aged care facilities across the city that have been affected, with staff or residents being infected, and so on a regular basis we're seeing cases in hospital settings or in aged care settings, and we've even had some disability settings as well. So there's an outbreak in a Summer Hill aged care facility with, I understand, 9 residents affected. Fortunately, many of those have been vaccinated, and as I understand it, the ones with vaccination are doing relatively well.
Are there any others of those who have been affected with COVID at that nursing home in Summer Hill? Have they refused vaccination, or family members have said they wouldn't be vaccinated? Can you confirm that?
I don't have that detail, I'm sorry.
Dr. McAnulty, sorry, just quickly. There are some reports of a growing cluster of COVID cases within the emergency department of a key hospital in Sydney. We've been told that some of those who were close contacts were actually forced to go back to work before getting their negative test result. What is the protocols that hospitals are supposed to take? And for the Premier, what does this say about the hospital system? Are they under stress? And what's the situation of hospitals in Sydney?
Yeah, we've got a very low threshold for making sure staff and resident and patients are safe, and so we have a well thought through matrix of decision making that takes into account a number of factors. So we would never force people to work if we thought they were close contacts, and we have got a range of surveillance strategies for making sure that that people are tested on a regular basis.
So Dr. McAnulty, would you isolate before they get in it? Before their test result comes in, they have to isolate. They would have nurses would have to follow that rule.
So there's a risk assessment done, and we have, in some circumstances, routine testing of people where they don't have to isolate if they're having ongoing testing and surveillance. But for other people where we have identified close contacts, then they need to isolate until for the 14 days.
Do you have a figure on? There's been discussion about people not actually going to hospital and dying at home. Do you know there's been 14 deaths now? How many people have actually died at home without going to hospital and seeking help?
Yeah, I understand 4 people have died out of hospital at home. Some of those have been identified subsequently of having COVID, and so that message about don't wait. First of all, if you have any even mild symptoms of you or somebody in the family, come forward for testing right away. Don't wait. Do it on the day that you get the symptoms. And secondly, if you have been diagnosed with the COVID and are deteriorating, don't hesitate. Call 000 if you need to go to hospital, or make contact with your health provider. So it's just so important we identify people early, because we know how quickly this disease can spread within whole households, and therefore, if you've got an elderly relative in there, they could easily die. So be very vigilant.
Are people who are dying at home subsequently identified as being COVID positive, so people who haven't tested positive to COVID yet, are they included in the total number that you report of deaths?
Yes, they are. So for example, sadly, there was a death a couple of days ago in somebody who was only subsequently diagnosed with COVID.
Premier, in relation to the 70% threshold figure and the 80% threshold figure agreed to by National Cabinet, do you accept that figure? And regardless of, did you back that figure? And regardless of the nationwide total, if New South Wales gets to 70%, will that be the point at which we can live more freely with this Delta strain of coronavirus?
Thank you for the question, James, but I just ask you to go back on the record as to how long I've been talking about the 80% figure in New South Wales for. It's been on the record for some time that 80% gives us much greater freedoms than we're seeing during the pandemic. But we know that it's also incremental. Once we hit milestones, once you get to 50% vaccination, 60%, 70%, it obviously triggers more freedoms. And that's why we've been saying in New South Wales with a sense of urgency, please come forward and get tested, as we've seen around the nation, whether it's prolonged lockdowns or whether it's short, sharp lockdowns. You can't live with Delta until the vast majority of our population is vaccinated, and I can't say that more strongly or more clearly. The challenge for us is to get as many people vaccinated in August as possible, so that by the time August 28 comes around, we have a number of options before us as to how we can ease restrictions, and I want to make that very clear. But we also need to make clear that things will be incremental. Once you hit particular milestones, you can look at where the populations are vaccinated, you can provide greater easing of restrictions, and that's why it's really, really positive that so many people are coming forward and getting vaccinated. But I want to challenge everybody to do better. Let's come forward and get vaccinated. We know the health advice says that the vaccines are both very safe, both very effective. I'm heartened by the fact that to date I haven't been advised of anybody in intensive care that's had both doses of the vaccination, and that's really positive. We also know that one dose prevents hospitalisation, but also reduces your chance of spreading it to others as prolifically. So it's so important for people to come forward and get vaccinated. The New South Wales position has been very clear. It's not lockdowns or restrictions alone that will save us through Delta. It's also higher vaccination rates, and we've been very clear about that. I'm very pleased that evidence provided to National Cabinet backs that as well, because it's not just lockdowns and restrictions, but that what will allow us to have a sense of normality moving forward with Delta and with other strains of COVID is higher rates of vaccination.
Do you agree with Brad Hazzard, Premier?
Can I just ask other people to have a chance? Thank you.
Yeah. Yesterday, your Health Minister said about 4 months could see us get to the 70% target. Do you agree with that, or do you think it could be a little sooner?
Well, currently we're vaccinating about 500,000 people a week. So obviously 9.2 million jabs is about 70%. 10 million jabs is 80%. So if we're doing 500,000 people per week, it obviously shows what can be achieved. But I'm keen to increase that and make it even stronger and higher. We have the ability in New South Wales to do more. The pharmacists have been amazing. We need to make sure more vaccine goes to them. The GPs have been fantastic. We need to make sure more vaccine goes to them. But also through our New South Wales health hubs, we have a number of additional mass vaccination centres opening, a number of places in the regions opening. So it's really becoming easier to access the vaccine, especially given the change in health advice around the AstraZeneca. So I'm urging everybody to come forward. At the moment, you can work it out if we're doing about 500,000 a week, but it's really up to us. If we increase that and do even more, it means we can get to that 70% quicker. But I also do want to stress that getting to 50% or 60% also allows us, it doesn't give us complete freedom, but it certainly allows us to be in a better position than what we are today. And that's why I'm really saying to everybody, if we increase the vaccination rates during August, it gives us much more options, many more options for the 29th of August. So the more people that get vaccinated, especially in those 8 local government areas, and I want to stress the New South Wales government is putting a full court press, to use a basketball analogy, in those 8 local government areas to encourage high rates of vaccination to go to communities, especially in, can I say, people in their 20s, 30s and 40s, because as Dr McAnulty said, we're finding with the Delta strain that it's people in that age group that are unfortunately bringing it either home to their parents and children or out there actively in those critical jobs. So we really want to also target the vaccine. Obviously, it's evident that the older people are more vulnerable, but people between their 20s and 40s are the ones, unfortunately, in those situations where they're more likely to get it or spread it. And so we're really focusing and targeting our vaccine spread in those communities, or vaccine distribution, I should say. So it's really up to us. The more people we can get vaccinated, especially in those 8 local government areas during the month of August, gives us a lot more options for the 29th of August.
There's a lot of disappointed and angry people on the Central Coast. They had bookings at the Belmont vaccination hub to get Pfizer, but their bookings have been cancelled because the doses have been redirected to Year 12 students. Do you have some empathy for those people?
Oh, of course I have empathy for those people, and we'd love to be awash of all types of vaccines. But we know that for adolescents, for people between 16 and 18, Pfizer is the recommended vaccine for them, and it's only around 19,000 students we're talking about. So when you consider there are 8 million people in New South Wales, when you consider we've been able to stop the spread of the virus in our regions and in other parts of Sydney in a massive way, it's really important for us to give those Year 12 students a chance to finish their exams and get rewarded for what they deserve. But also please know that we are finding, obviously, younger people are getting the virus and spreading it, those older adolescents. And so it's also a mitigation. It's also a way of focusing our energy in those southwestern Sydney and Western Sydney local government areas, and that's really important. At the end of the day, all of us are making sacrifices to reduce the spread and to get us out of lockdown as soon as possible, and I really thank people for all the sacrifices they're making, because it is a very challenging time. So if you happen to have been asked to wait a couple of weeks before you can get your vaccine, please know the AstraZeneca only has a 3-day wait on average. So everybody who's over 18 is able to get the AstraZeneca. If you have any concerns, you can speak to your GP. But all of us are having to make those sacrifices, some more than others, I accept that. But this is all because we want New South Wales to get out of our situation as quickly as we can, but also to limit the spread. And it's really important, in particular, for younger people, people up to their, in their 30s in particular, to get access to the vaccine as soon as possible.
The Central Coast is
Just on the situation with the reports that some nurses were forced to go back to work when they were supposed to be isolating. What does this say about our hospital situation at the moment? Are they under stress and are they understaffed, particularly with increasing ICU cases?
Can I just say that I've never heard of anybody being forced to work when they should be isolating. So I dispute that, and I haven't had any examples brought to me. If that's the case, I would dispute that, because we have many staff members on the beat in New South Wales. In fact, as the Health Minister says, we have over 140,000 people working in our health system. So, but it's really important to note that when you are in the middle of a pandemic and you're having cases cases every day. Of course it stretches things. Of course you need to put in greater safety measures than ever before, because even though people are vaccinated, you can still obviously get the disease and pass it on to others. So the health settings are critical, and we've seen that the virus is spreading in particular health settings, especially if non-vaccinated people come in with the disease. They might not know they have it. They're coming through an emergency department. So obviously that puts extra pressure on the system. However, please know that the system is meeting that challenge, that demand, and we've reallocated resources where we've needed to. I get briefings from our health officials on a daily basis as to how resources are reallocated to fight the pandemic, and that means all of us are in this together, and all of us know the challenges. But please know that we're throwing everything at getting out of this lockdown as quickly as we can, and the community is really being amazing during this time, because we're asking a lot of people, and people are stepping up. And I know it's really difficult, but everybody is playing their part. And for August, I'm asking everybody who hasn't had the vaccine to come forward and get vaccinated, because the higher the rate of the vaccine, the more options we have moving forward, the more options we have to getting to that 70% or 80% quicker. And we've been using those numbers in New South Wales. I've been conservatively using that 80% number, that 10 million jabs, for a long time. But if we get to 50 and 60, that gives us extra opportunities to ease restrictions and have a more normal life ahead of obviously getting to those other targets. Sorry, someone hasn't asked a question yet.
Premier, just on the 20s to 30s age bracket, we're hearing story after story of people in that age bracket wanting to get AstraZeneca. They're going to their GP and their GPs are saying, no, wait for Pfizer. What are you doing about that? Because that messaging is very different, and the messages has consistently changed over months.
Yeah, well, look, the New South Wales government always follows the advice of the federal health authorities, and of course we ask everybody to follow that health advice. But the health advice in New South Wales is that if you're over 18, it is safe to get either vaccine. And that is a strong health advice.
So you're working with GPs, because GPs are still telling people in their 20s and 30s that it's not
I'd be concerned if that was the case, but that's certainly the advice that's provided to New South Wales and Greater Sydney. And remember, Greater Sydney is going through an outbreak, and that is the best health advice available. And if people do have concerns, they can speak to their GP. But can I stress that we have plenty of AstraZeneca. It's a safe vaccine. People should come forward and get vaccinated. There are still people in various age categories who haven't had any dose of the vaccine. We urge people to come forward and let August be the month where we break records in vaccinations, because that is our ticket to freedom. And I don't say that lightly. It's been something the New South Wales government has been saying for a long time. There's no place in the world that's been able to live with the Delta virus and not had higher rates of vaccination. We have to be very clear about that. We want to ease restrictions as much as possible, but the extra weapon we have in being able to ease restrictions is higher rates of vaccination. And at various milestones, you can provide more easing to your population. And we know that if August is the month where more and more people get vaccinated, we can get to those targets more quickly. And certainly at the moment, we're doing about 500,000 in New South Wales a week, but we can do better, and I'd like us to.
Yeah, we hear a lot about people who are not getting tested as soon as they have symptoms, people waiting before they get a test. Is part of the problem that people who work essential jobs don't want to lose shifts because they might lose money? And if so, would the state government consider providing a payment to people who need to isolate between getting the test and receiving the results, because currently there is no payment for those people?
Yeah, no, I think the issue is broader than that. For a variety of reasons and a variety of age groups, unfortunately, people aren't coming forward to getting tested, and they're in denial, thinking they don't have the virus. But the strong message we need to get to everybody is you can deteriorate very, very quickly. You might start off with a mild symptom. I'm not a health expert. I'm just repeating what our health experts tell us. You can start off with very mild symptoms in the morning, and by the end of the day have very severe symptoms and succumb. And it's very sad when people don't even get any medical help and are dying at home. But we're going to see more and more of that unless people come forward and get tested. It's better to know you have it, because you can protect your family, you can protect your co-workers if you're working, you can protect everybody you love if you come forward and get tested. And most people are. If you look at the size of our population, how quickly the virus spreads and the numbers we have, on the whole, people are doing the right thing. But as I said, it only takes a handful of people to be scared. Sometimes it's through fear. Sometimes it's through not wanting to accept what it could be. But please know, to protect your loved ones, if you have the mildest of symptoms, come forward and get tested, no matter what situation you're in. It may be people, but can I say there is support there for people, and can I again reiterate all the levels of support. You have disaster payments if you can't work. You have small business, medium business and large business grants if you're a business in trouble. But you also have direct support we're providing for communities in those 8 local government areas. The government is working with community leaders to provide direct support, financial and otherwise, in those 8 local government areas on top of everything else.
There's no payment for people who are forced to isolate whilst they wait for their test results, and there's also still no payment for people whose boss wants them to come into work but they don't want to.
Well, can I stress that in relation to test results, on average, the best advice I have is it's a 28. If you're suspected of having the virus, it's a 28-hour turnaround time in knowing whether you're positive or not, and obviously positive results are notified quicker than negative results. Having said that, if for a few days you're not able to work, there is support available, and whether it's through local support we're providing non-government organisations to provide direct assistance to communities on the ground, through those disaster payments, through the small business grants, I just want everybody to know that you will be supported by respecting and following the health orders, and nobody will go without. It's very important for people to get tested as soon as they have the mildest of symptoms. But sometimes we're seeing people that aren't in the workforce, people that don't leave their households necessarily, also refraining from getting tested. It's not a specific category of person. And so we just say to everybody, we are in the middle of a pandemic. It is a health crisis. Hopefully we'll look back into history and realise this is the most difficult period of time our state has ever been through. So we have to act like it is in all situations. We are going through something which is unique, something which I hope no other generation experiences, but something which we need to deal with in a different way. And please know that if there are any gaps, we're filling them. We're actually doing a lot of work with non-government organisations in those 8 local government areas to provide direct, on top of what we've already got in place, providing direct financial assistance, providing other support to families and communities who may have a few days where they're challenged.
James Coleman, it's not a one-on-one.
Premier, we're getting reports right across Greater Sydney that a lot of Year 12 students are actually terrified about coming to work. It's understandable. Going to school.
Yep.
Do they have to go to school?
Well, look, can I make this point that we're working very closely, and I got a briefing by the health experts this morning about Year 12, and we'll have more to say about that. But at this stage, and again, I don't want anyone to get complacent or drop their guard, but outside of those 8 local government areas, we're not seeing a huge spread of the virus. So I want to make that very clear. However, in those 8 local government areas, obviously the virus is still a major challenge. So we will have more to say about what Year 12 looks like on the 16th of August, but we'll also put public health and safety first, including the students. But from the 9th of August, we do want to vaccinate all the Year 12 students in those 8 local government areas. So in the week of the 9th of August, all those students will be vaccinated. But please know that health and education are working very closely. We don't want many students on campus at the same time, especially in those 8 local government areas. So we'll proceed on a very conservative, cautious approach, but our goal and our mission is to make sure that Year 12 receive their HSC, that they receive the credentials they've worked so hard to achieve, and obviously health and education are working closely together. We'll have more to say about that closer to the 16th of August, but our intention is to make sure that every Year 12 student has the opportunity to be rewarded and awarded this high school certificate based on the fairest assessments moving forward and the safest assessments moving forward.
What about teachers?
The Department of Education has green-lighted testing for students to return to school as a screening process rather than diagnosis. Should the TGA be fast-tracking that? Currently, that's against the rules for any at-home tests.
Well, look, we're working through all those issues, and we're not leaving any stone unturned, put it that way. Our aim is, our intention, if you look at priorities, obviously all of us want more freedom, but I think all of us also accept and understand that Year 12 attaining those credentials is so important. We want to reduce their stress. As I said, it's stressful enough sitting for the HSC, let alone in a pandemic. It's stressful for parents and families, and we want to make sure we provide those best opportunities in every which way we can. And we're doing a lot of work on how we can not only have some level of face-to-face for Year 12, but also in a safe way. So please know there'll be very strict conditions, especially in those 8 local government areas. We don't want the situation to get worse. So we're not going to take a decision that's going to worsen the situation, but we'll take a decision based on the best health advice. robust and also one that supports Year 12 students and their families. But that's why it's really important for Year 12 students to get vaccinated in the week of 9th of August in those 8 local government areas, because it does give us more options in terms of the type of face-to-face presence they can have.
Is there any problem with your state's hubs talking to Medicare? Increasingly people have to chase their vaccination records because they're not accurate on the Medicare system if they've received doses through the state system. Is that a problem you know about? And is it going to affect our rates? Are we still accurate in knowing how many people are being dose vaccinated or
please know that New South Wales, especially Service New South Wales and New South Wales Health, are working very closely with the Commonwealth to make sure we have access to data and also a way in which people can have the right credentials to demonstrate they're vaccinated. So that's a priority for us. People shouldn't be worried about. Our data is very good at this stage. We're able to take we get daily updates as to how many people in New South Wales have been vaccinated and the records. And please know, of course, that's protected, it's confidential, but we are looking at ways in which we can provide credentials to people moving forward so that down the track people can demonstrate they've been vaccinated. But I'm very heartened by the rate of increase of vaccination in New South Wales, and you'd expect that. When you're in the middle of a major outbreak, you do expect and want people to come forward and get vaccinated, and we're seeing that occur. And at the moment, we're getting around 500,000 done a week, and clearly we need to do more.
In terms of teachers and vaccination, just in teachers and vaccination, are you confident that by the time Year 12s go back that all teachers in that those 8 LGAs will be vaccinated if they want to be? And what about sort of in terms of how many teachers across the rest of Greater Sydney have been vaccinated?
Yeah, look, we know that some cohorts of teachers had already received the vaccination prior to the outbreak, but obviously if you're a teacher or any critical worker, or any citizen, doesn't matter what you're doing. If you're mingling with other people, well, mingling's the wrong word to use, we're not meant to mingle, but if you're interacting with anybody at all, you should be coming forward and getting the vaccine. And we know for all adults, the AstraZeneca is now recommended. So all adults are able to get the AstraZeneca, but for adolescents, for 16 to 18-year-olds, the health advice is Pfizer, and that's why we're managing the supply we have in that way. But because we're keen to get back to a sense of normality in New South Wales as quickly as we can, we're making the best of what we have, of course, and we're also not leaving any stone unturned. So we urge all adults to come forward and consider getting the AstraZeneca, and if they have any concerns, obviously go to your GP. But there is a cohort of various workers who've already received vaccines, even prior to the outbreak. But we're urging everybody who's over 18 to come forward and get vaccinated.
Premier, on the Central Coast...
Yeah, I'm sorry.
On the Central Coast, that's part of Greater Sydney, per the lockdown. So why are their Pfizer doses being redirected into...
Oh, I understood it was actually the Hunter area health. Yeah, I actually thought it was the Hunter, not Central Coast, but I'll have to get back to you.
Being told that
yeah, no, the advice I had was it was Hunter. But in any event, it is a small number of doses that are reallocated, which means some people have to wait a few more extra weeks. But what it also means is that we can contain the spread. We know, unfortunately, younger people, people under 39 now account for about 60% of cases in New South Wales. And it's interesting that the research we're being provided by through the experts also tells us that unlike other diseases that are infectious, it's people in their 30s and 40s that are most likely to get it and spread it. But what that means, obviously, is vulnerable people are more likely, older people are more likely to succumb and die, but the people who are unfortunately getting it and spreading it are people under 39. That's why it's really important for us to focus on that cohort, especially in those 8 local government areas of concern. And the more people that get a jab in those 8 areas of concern means we're able to stop the spread, because some households are very large. Some households, households of up to 7 or 8 people are quite common. And if you can, if you have the disease and you go home, at the moment, if you're not vaccinated, you're likely to give it to every single person in your household. But if you're vaccinated, you might reduce the number of people you give it to, and then that obviously reduces the spread moving forward. And that's what we're keen to do.
Premier, Queensland's snap lockdown, I mean, should that be done? It's supposed to be over, I think, Tuesday, 4 p.m, 4:30 p.m. Should that be done and dusted within a couple of days, cases don't escalate, will you then concede after that and Victoria that we should have gone earlier? I know this is retrospective, and I know you want to look to the future and not the past, but it's very important to know what's in Cabinet's minds at the moment.
Well, I think what's important to note is there is no roadmap for the Delta variant. And, a benefit of hindsight is always a great thing to have, but, other states might be facing regular lockdowns in and out all the time. And what I'm saying for New South Wales is we want this to be, yes, it's painful, but we want this to be the last lockdown we have, and we can make that happen if we get vaccinated. Because other states have shown, yes, they're going in and out of lockdown, but that's no way to live. the rest of, whilst our vaccination rates are where they are, it's no way to live going in and out of lockdown all the time. I'm not suggesting we're in a good situation and being in lockdown. It's hard. It's damn hard. But our strategy for New South Wales is to get those vaccination rates to 60, to 70, to 80%, because that means we can live with the Delta variant. We won't have to go in and out of lockdown. Because I think what it shows is that no place on earth can live with a Delta variant without having some kind of restriction, without having some kind of in and out of lockdown stage.
Did you underestimate Delta, Premier? Did you underestimate it? The messaging very early on was this is scary, this is highly virulent. Have you underestimated it? Is that why we're in the situation
again, there's no roadmap. And I knew, we all knew earlier on this was a very scary variant, but we also never know. This is a challenge with Delta, the undetected strains of transmission that may have been in the community, which we didn't know about. And that is really critical to assess. But there's no roadmap for Delta. There's no perfect way to deal with it. And of course, with the benefit of hindsight, you always think, various options could have existed. But the reality is, if you look at other states in Australia, if you look at the restrictions that are in place, life with Delta means lockdowns one way or the other, and that's not a way to live, which is why we've been saying in New South Wales we'd like this to be our last lockdown, so long as people get vaccinated, because living with Delta and we don't know what's around the corner without being too scary. We don't know if there'll be other variants that'll be as contagious or more contagious. But what we do know is the vaccines work, and vaccines and high rates of vaccination, even when you get to 50% of the population vaccinated, it gives you that ability to have more freedom. 60% and obviously 70% gives you a whole lot of more options, and 80% is great. 80% of both doses for the adult population gives us a whole range of opportunities to live with the variant without going in and out of lockdown. There is no perfect solution. Our lives will be disrupted until we have those high rates of vaccination, and there's plenty of examples around the world. And look, I'll never suggest we've done everything perfectly. I'll never suggest we're mistake-free. We never are. We never have been. But what we do know is that the only way to live with Delta or any other horrific strain that comes along is vaccination, and that's why I can't stress that enough. I took advice from Dr. Chant about that 80% figure months ago, and I've been talking about that 80% for months. And that's why I've been having a sense of urgency about vaccines, because you can tell we're lagging a bit because we've been protected in Australia, but you can see what's happening around the rest of the world. Unless you get a vast majority of your citizens vaccinated, we won't have normal existence with Delta, and that's proven.
Do you think we can turn this situation around in 4 weeks? The Health Minister, Brad Hazzard, today said he wasn't sure. What do you think?
Oh, look, of course we can, but there's a lot of things dependent on that. Firstly, higher rates of vaccination, especially in southwestern and western Sydney, where we know the virus is particularly virulent. Secondly, people continuing to do the right thing, and higher rates of testing. So we know we've been successful in preventing thousands and thousands of cases until this point in time. But we also know how challenging it is to reduce the number of cases that we have. But with higher rates of vaccination, we can do it. With higher rates of testing, we can do it. And so let's make August the month where more and more people come forward and get vaccinated, because the vaccine is protecting human life, it's keeping people out of hospital, but it's also helping reduce the spread. And what's really important for us is to make sure people in those 8 local government areas have the vaccine, have access to it, because with all due respect, people getting vaccinated in other parts of Sydney is fantastic, and we need to make sure that continues. But we need to make it happen, especially in those areas of concern, because it will stop the spread as fast. It will slow down the spread. It will allow us to stay on top of it and allow us to follow up cases as quickly as we can. So my message for August is it's the 1st of August. I'm always an optimist. It's a month where all of us should come forward and get the vaccine. And the more we get vaccinated, the more jabs in arms, the greater our pathway to having an easier life moving forward. Thanks, everybody.
Right, that